I'm Kevin Grieme, the director at Siouxland District Health Department. Thanks for joining us today with the joint press conference here between Siouxland District Health Department and Dakota Public Health Department. It's kind of an exciting time here, but just a little bit of a look back is on March 20th of 2020, we stood in this almost exact same place announcing the first case of a COVID-19 virus in Woodbury County amongst residents. We flash forward to today, and we now have well over 11,000 total cases that have occurred in Woodbury County and over 140 deaths. But today's information that we want to share with you has been a long-awaited announcement on both sides of the river. And this is the imminent receipt of vaccine to begin to protect our most vulnerable populations in both Woodbury County and Dakota County. So I think it is time that we kind of visit with you and share with the general public, because just like we have worked and requested cooperation with our mitigation efforts in wearing masks, etc., we also need to further rely upon their cooperation to truly make this successful and not to continue to tax our limited resources. Siouxland District Health Department is proud to announce that we were notified of our initial allocation of Pfizer vaccine. This is the vaccine that received emergency use authorization just this last weekend. We are slated to receive in the next few days 1,950 doses of vaccine of the Pfizer. Our plan at this time that we have worked with community partners to develop is to really look at the priority audiences of healthcare workers. What the community needs to understand is that simply within Woodbury County, we have over 4,000 individuals that are employed in our healthcare businesses and companies. So we don't even have enough to meet half of the demand that's there. So it is still in limited supply. So what I want to visit with you also about is some of the planning that we've done related to how those 1,950 doses will be distributed. First and foremost, we're looking at getting those doses to those healthcare workers that are probably in the higher risk categories of the work that they do. Our physicians, our nurses, and other staff that work within the emergency rooms and also are treating the COVID patients that have been admitted to the hospital. We understand and we recognize that those individuals probably pay the highest price related to risk of acquiring COVID themselves. Once we have met the requested demand for the vaccine within those audiences, we move into a second tier of within the healthcare area. These individuals that have a higher propensity to be exposed to it, but not necessarily the frontline workers. And then the last tier within the healthcare industry are those that are probably more in a supporting role. But what our goal to do is the initial vaccine to come in is to really address the needs of our healthcare population. Now, a separate source of vaccine that will be coming into the community is something that they have developed with a national pharmacy network, and you may have heard about this from other sources. But within Woodbury County, almost all of our long-term care facilities are linked in with the pharmacy network. What this means is we do not have to utilize any of the 1,950 doses for the long-term care facilities because they will be receiving that directly from the pharmacies. CVS, Walgreens, and Community Pharmacy are the three entities serving Iowa. They will be receiving the vaccine, and they will be working with those long-term care facilities to get their residents and their employees protected and that vaccine administered. The next round we're anticipating is when the Moderna vaccine gets its emergency use authorization, there's an additional 400 doses that are coming, and that'll be received by Siouxland District Health Department. With this vaccine, we're looking at our priority audiences of reaching out to the first responders that actually exist, our EMT, EMS squads. We want to make sure they're protected because they will reach out and they're in the homes of cases. In addition to that, then we'll filter it back into the healthcare priority areas because we think that's probably the most prudent thing to do. So I think as we're doing that, then the next thing that kind of comes about with this is everybody knows that this vaccine to be truly effective requires 2 doses. Our practice is not to withhold the second dose out of any assets we receive. Our intent is to offer 100% of the vaccine as we received it out to these priority populations. Then 21 days later for the Pfizer, we look at going back with additional assets and giving the second dose to those individuals that received it the first time. And then with Moderna, we'll go ahead at the 28 days. But our goal is not to withhold anything to get the 2 doses in the original audience. Our goal is to get everything we receive distributed. I think in addition into looking with some of those priority areas then, when we move forward there's been a lot of discussion related to some of the other businesses that might be considered essential. They will essentially be met in their demand, but at this point in time with the limited supply, we are not able to meet that demand. We will plan for the future. At this point in time, I would like to introduce Natasha Ritchison, the director from Dakota Public Health Department, and she's going to share some of the information and planning they're doing on the Nebraska side of the river. So Natasha.
Thank you, Kevin. The initial shipment of the Pfizer vaccine to Nebraska will be a total of 15,600 doses. The state of Nebraska is receiving the Pfizer vaccination this week, and it will be sent to Nebraska hospitals throughout the state. The hospitals that will receive it are the ones that are able to support the ultra-cold storage needs. No specific locations of the allocations will be made to the public due to security reasons. Dakota County Health Department does not anticipate receiving allocation of the first shipment, as we do not have a Nebraska hospital in our jurisdiction. When we do receive the vaccination, we will initiate phase 1A within Dakota County. Availability of vaccines to the general public on a widespread basis is projected by the state officials to be sometime in April. Since there is a limited supply of vaccine available, local healthcare providers must prioritize segments of the population. For the state of Nebraska, the phase 1 category is as follows. Phase 1A are healthcare personnel. This includes hospitals, home health, pharmacy, EMS, outpatient, public health, and long-term care facility residents and staff. And as Kevin spoke on with the pharmacies, the long-term care facilities within Dakota County, they are all covered under the federal pharmacy program. They have partnered with pharmacies to distribute then the appropriate immunizations and allocations to those. Staff 1B will be staff at correctional facilities, key personnel working in education, food and agriculture, utilities, and transportation. For Group 1C, those people are the 65 years and older, the vulnerable population, and persons in congregate living settings. As Kevin spoke on December 17th, there will be a discussion on the EAU of the Moderna COVID-19 vaccine. Thank you.
And I think the part that we need to also look at, this was when we're looking at the cooperation of our public and our residents, is many individuals are out there that fall under the underlying conditions, age, risk, and those types of categories. Those individuals, what we have encouraged is their primary care physicians to go through and do basically an inventory of their patients who fall under those categories. So it's not necessarily to call to seek out the vaccine. Their intent is to promote and contact those individuals to let them know when there is adequate vaccine available for them to come in and have it administered. So it's not necessarily to call. Now related to this, as we released last week, we also want to remind and alert area residents, there are individuals out there, sad to say, that are attempting to scam people. They're calling individuals that may have any of the underlying conditions related to age or health conditions, and they're trying to convince them to produce credit card or other financial information so they can either reserve a spot or ask basically to be moved up on the list to receive the vaccine. This is not anything that is going to play any merit related to their ability to get it. It is simply a scam out there to take advantage of some of our vulnerable populations. So we must remind our viewers that they're caregivers of any elderly individuals or other individuals. Be sure that if you're called and contacted, hang up. Understand that this is a scam. It's not anything that either public health agencies will engage in as far as distribution of the vaccine. Also too is when we take a look at some of this, we will also then, once we get out, as Natasha mentioned, the general pods or the distribution networks, we will then be sending out stuff through the media to alert if and when those are available. And so I think it's going to be a multi-layered. We don't know the timeline. We've got varied reports. We can't confirm exactly how quickly and how proficient our supply will be over time, but guaranteed our priority is once it comes in the door, we have a distribution opportunity set up to meet the next level of the planning that we put together. And I think last and foremost is what it was. Even during this time and after the vaccine is beginning to be delivered, we have to encourage residents to continue within the mitigation efforts. We We've seen a wonderful response, I think, to the masking that has occurred. In addition to that, talking with people about limiting the size of their gatherings, keeping the gatherings within their household, and some of those efforts that they may have engaged in that has truly reduced the spread and the number of cases produced because of COVID-19. And we need to ask for that continued response. And in fact, we did send out to the television stations. We do have a PSA we distributed this morning that's been developed by both Dakota County Public Health and Siouxland District Health, and it has some community leaders just emphasizing the fact of the impact that masking and other mitigation efforts can make. So, no further information. I would like to open it up right now to any questions that any of you may have.
Kevin, for you mentioned, I know the timeline's vague, for the National Pharmacy Network distribution, do you anticipate that starting in December for long-term facilities, or is that maybe more towards springtime?
We have actually heard that we understand the distribution of that could begin as early as towards the end of December. Now, the timeline for those pharmacies to get it delivered to the long-term care, that's up to each individual one, but that probably, I would say, within the next month, we should begin to see that vaccine being administered in those facilities.
Just want to confirm, and this is, Natasha, you can point this out, Dakota County will not be receiving any vaccines as of this moment? Correct. So can people from Dakota County come over to Woodbury County to get vaccinated?
At this point in time, eventually that may be a possibility, but at this point in time, because we have these priority audiences, we will not have any vaccine that's publicly available for those individuals. Therefore, it'll be pre-identified audiences, and most, if not all of those, will be within the healthcare field. Other questions?
The timetable for Moderna then, do you anticipate that before the month is over too?
What they actually have talked about for a timeline is on the December 17th is when the emergency use authorization request will be considered. If that is then accepted and then also accepted by the FDA, then we would anticipate potential beginning shipping of that as soon as December 21st or 22nd. And so that'll go out to whatever organizations or entities that have been designated as receipt of that. And I think another piece of this, and it's important in the Siouxland District Health Department and public health agencies, is that we actually serve in the role as the allocation agent. So we are working with this network of community partners to begin to determine, because in an electronic system, we get an allotment of vaccine that's offered to Woodbury County. And what we have to do within this system is we have to move through and identify those facilities or entities that will actually be receiving it. So that allocation process does come through Siouxland District Health Department for Woodbury County. So I think that's a thing that it's important for us to take into consideration, all of these groups and all of these factors.
Kevin, the last couple of weeks, the hospitalizations for Woodbury County hospitals gone from the 90s down to, I think we're at about 56 today. So is that an indication that people are doing the things they need to do? I mean, you talk about still wearing masks and this social distancing. It doesn't look like we got a huge spike out of Thanksgiving, fortunately, since the numbers are down by about half now.
Right, and I can't necessarily speak to the hospitalizations. I know it's just in the new cases, which is probably a more data set that we track. We have seen a reduction on the day-to-day report. I mean, we haven't been in the triple digits for a while now as far as the reporting of new cases. And I think that's a combination of the individuals wearing a mask. We're pretty certain that a big implication on that was the limitation on number of individuals at some of these activities and events, where they turned around and they limited 2 spectators per athlete. And some of those groupings, it just created smaller audiences, which then limited and reduced the amount of spread that would occur within those groups. And so we think with everything that's been going on, and I think that's part of what we have to recognize is what is the process and the steps in continuing this sort of progress. We don't want to necessarily look at opening everything up all of a sudden at once, because we don't negotiate that well. But how do we turn around and support our business community and that sort of stuff, continue to support them to make them viable, to also support their business, but then again, don't put us in risk for increasing the spread. I think it's a difficult balance to achieve. But I think some with the masking, the reductions in some of the participation and people allowed, those have probably what's had a positive impact, because if you have less cases, there's less potential for those individuals escalating to such an age that they become hospitalized.
Kevin, we're 10 days out from another busy holiday that in any other year would be totally safe to travel. What do you want to say to the people of both Woodbury and Dakota County as they go forth with their holiday plans? How should they go about that safely?
I think what they need to take a look at, and in conversations we've even had with some of the religious organizations, we have really told people that I really tell them to focus on, think from the concept of the household. Who are those individuals that you're most regularly and consistently around? And keep your celebrations to those sorts of limits. As far as travel, if you're beginning to merge, there is some inherent risk to that. It's not considered completely unsafe, but there are additional risks and proactive things you should do to reduce the potential of you acquiring COVID-19. So make sure you're paying attention. Find out from your airlines, do they have limitations in flights? Do they have seats sort of that they have just held open so people can space out? What are the airline practices at the mechanism they're traveling? If they happen to be traveling by automobile, be very astute when they make any sort of stops along the way. Interactions that they occur. If it happens to be a busy gas station, is there a chance they could drive on to another that would have less of a crowd there? But I think it's really about what would be assumed risk. Our real priority would really have people kind of limit those types of exposures, because the reality of it is, it's not necessarily the location where they go that suffer the consequences, that when they come back and that 8 to 10 days later when they're back home, that's when we anticipate potentially seeing numbers.
Kevin, with the 1,950 doses that you guys received, and I'm just trying to get some clarity here, and maybe some other people had the same question, but is that just the single dose, or does that also play into the second dose? So do you like cut it in half and say
No.
you get both doses, or is that just the first dose?
The 1,950 is the total number of first doses that'll be coming in. What we have been told and understand and what we're planning for is the aspect that in the national distribution chain, they have turned around and factored in. So they should be, in about 3 weeks, reallocating another 1,950 doses, so the second dose can be offered to those individuals that received it the first time. That's why we decided, we made the decision, we're getting it out there, dose number 1. We're not reserving anything for that second dose. Other questions? If not, everyone, thank you very much for your time, your participation, and your continued support.